Good morning. To introduce myself, my name is Maureen Watt. I am part of Takeda. I work in research and development. I am not a scientist, I'm a data scientist. I work within our global evidence and outcomes team. And I'm here today to present on our topic of living with central disorders of hypersomnolence, understanding the impact on daily life. And I'm going to kind of set a little bit about what I'm going to talk to you about today, about two studies that we have conducted at Takeda within my team. Firstly, talking about our systematic literature review, and then leading on to tell you a little bit more about a patient survey we conducted. So when we carry out our planning for doing any of our patient surveys, the first thing we like to do is actually review the literature and really understand what do we already know. And in order to do that, we carry out a systematic literature review. And then those of you who are observant in the room will have noticed that this is a presentation on European patients. I'm very much aware I'm not in Europe today, but actually where I think there's a relevance to tell you about the findings of this study of patients in Europe living with disorders of central disorder of hypersomnolence. Firstly, there is a global relevance of the findings. There are symptoms and experiences that are relevant for patients, whether you're in Sweden or the UK or Canada and the US. But also, following on from doing this study in Europe, we have also been conducting the study in the US and in Canada with the help of the Hypersomnia Foundation. So a huge thank you to the team. And I look forward to at some point in the future coming back at whether here or a different situation to tell you more about our findings from our study in the US and Canada. But for today, we're going to move back to Europe. So let me just start with giving you a little bit of understanding about what we did, trying to understand what's already out there in the literature. So when we conduct these systematic literature reviews, which is a very specific way of what we're trying to do is understand what's already out there, what's already published, what have other scientists and clinicians and academic researchers, what studies and work have they done in a specific disease area. And the objective of this is really to level set understanding and report in a systematic way about what is already known, and then also to what is not known. What are the gaps in our understanding? And why do we do all this? Well, by summarizing and organizing all of this information into studies such as a systematic literature review, we're really helping healthcare professionals to understand and make better decisions for their patients by thinking about what is the most effective and complete understanding of what we know about different diseases and conditions. So when we conduct a systematic literature review, we start out with what are our criteria? What types of studies are we interested in knowing? Are these studies that are collecting information from patient observational studies, from real world registries, from patient surveys? We set out a clear definition of what we're trying to capture in this systematic literature review. And then we're only interested in information about this. So the objective of this systematic literature review, the full title was The Diagnostic Challenges and Burden of Idiopathic Hypersomnia, a Systematic Literature Review, conducted by my colleagues there and was published in the journal Sleep Advanced in 2024. Now, the objective of this was, let's look at the literature from the last 10 years. So from 2012, 2022, to really understand firstly, what is the diagnostic journey for these patients? What is in the literature that we know about the experiences of individuals on their diagnostic journey? And then secondly, in addition to that, really understanding following the diagnosis for these patients, what is the impact on their daily life? What is the impact on their overall quality of life? How does that impact from a functional perspective? And how is that impacting them from a work productivity perspective? So all of this is what our objective, what we're trying to look into, what we're trying to capture. And when we searched the clinical and medical databases for peer-reviewed journals, we identified 410 studies. So that's a lot of papers. So we then have an inclusion criteria of what exactly are we including. And from reviewing the abstracts and the titles of all of these 410 papers, we narrowed it down to 133 potentially eligible studies. And then from there, We're following reviewing of the full paper, reading everything that's reported. We rejected another 36, and we came up with a total of 97 studies included in this final systematic literature review. I have been part of those studies where we've included 900 papers. That is a lot of time with a lot of data extraction. But for this study, looking at the challenges and the impact of idiopathic hypersomnia, we included 97 papers. And what we're looking to do is really understand diagnosis and their impact. So what were the key findings? Well, what we really wanted to understand is, what is that symptom profile that we are seeing for patients with IH? And really that excessive daytime sleepiness is required. And I feel that I'm standing here telling you about the symptom profile to many people in this room who have lived it and who hear about this on a daily basis. But we really were trying to capture this not only from an IH perspective and seeing what is the variance in all these different symptom profiles, because we do know from the literature and from talking to patients and clinicians that actually the prevalence of all these different symptoms really varies from patient to patient. And our study also looked at understanding these symptoms across patients with narcolepsy type 1 and narcolepsy type 2. And that excessive daytime sleepiness is present for all of these patient subtypes. But we see that cataplexy is only common in those patients with narcolepsy type 1. And then the range of those different symptoms across those different patient types, we see that there's shared symptoms, some that occur more frequently for other patients. But all of these different symptoms impact patients on an individual basis differently. How these symptoms present and they impact their functional impairment, how they impact in their cognitive abilities, their ability to work and live their everyday social life is very individualistic. So our findings from this review of the literature gives an understanding about the challenges of these shared symptoms across different hypersomnia conditions, that having these variants of symptoms really presents a challenge for physicians that might not fully understand the disease, and that perhaps the next steps and the call to action would be to develop a diagnosis criteria specific to IH to help enable and make it easier for patients to get to that correct diagnosis. And then our findings related to the burden of the disease, that all of these symptoms and the variance of these symptoms really impact patients in terms of their social, their emotional, and their professional lives. And also within the findings that we found that there were a limited number of treatment options available. And really our kind of call to action was to develop treatments that target the mechanism of the disease. So across the 97 papers, we had written up this and published it as a journal article. And that really gave us the founding blocks to start thinking about how we would collect information about patient symptoms, about how it impacts their lives in our patient survey in Europe. So again, this first slide just kind of gives that overview of those symptoms, how they're overlapping across these 3 different conditions. But I really want to get in to tell you a bit more about how we did this survey. Whenever we do patient surveys at Takeda, we follow, there's a clear pathway of how to do this correctly. First off, we're not doing this just ourselves in Takeda HQ. We involve some key clinical experts across each one of the countries. And we have that discussion about, this is the findings that we see in the literature. How do we ask patients about their experiences in a systematic, in a replicable way? And then also we develop this questionnaire. We tend for these types of patient questionnaire, we don't want to ask overburdening questions. We're not going to sit down and ask a question that's going to take you 2 hours to complete. So we want to be really specific and ask about the symptoms and about the disease impact that is most relevant, most burdensome, and we need to be focused with the patient's time. And so for that, we try and develop questionnaires that really would take no more than 30 to 40 minutes for a patient to complete. And then following developing the questionnaire with the clinicians, with the patient groups, we will then, for every single country, take it to an ethics board for approval, and we'll explain what we're trying to do. And this will be, in the case that we're talking about here today, a one-time survey that we would send out to patients through different ways, and then take that data back and then report it out either at clinical congresses, in a manuscript, or in a setting like today. So I've kind of talked a little bit about how we're doing it, but let me actually share with you and show you what we did and what the results looked like for this survey in Europe. And we're capturing information about the social impact, the mental impact, and the financial impact. And our objectives, to surmise, to estimate the annual costs and health impacts for patients with NT1, NT2, and IH based on the severity of their symptoms. And we're looking at that across a number of different ways. How does narcolepsy affect daily life? And what are the costs and healthcare burdens with this condition? So we looked at this in 6 different European countries: Germany, France, Italy, Sweden, Switzerland, and the UK. Our focus for this were they had to be adult patients, so over 18 years or older. They had to have a diagnosis of NT1, NT2, or IH. But when we say self-reported, what we are implying by that is that we didn't do any follow-up checking. We are asking you as a respondent to this survey if you have one of these conditions. There was a 4th category if you had an other hypersomnolence condition. But we weren't doing any further checking going back into anybody's medical records. All the data that is collected is purely from this survey. And we also excluded anybody who is currently participating in any ongoing clinical trial as well. So we partnered with a number of sleep experts in the clinical field for this, within each of the country representation. In Sweden, we also partnered with the disease registry. And we also partnered with a number of patient organizations as well. And we have in that lower quartile there just a little breakdown of where these patients came from in terms of how they were recruited. In total, we had over 1,818 respondents who completed the entire survey. And we have here the breakdown. Just over half, 929, were narcolepsy type 1 patients. We had 204 narcolepsy type 2 patients and 362 patients with idiopathic hypersomnia. And in that other category, the 4th category that participants could respond to was other hypersomnolence conditions. The average age for these respondents, I think it gives away my age when I say they're relatively young, between 37 to 40. So individuals who on average are of a working age. We did see a skew in the responses of where the majority, between 67 to 80%, were female. We see that quite often in these patient surveys, whether it's in narcolepsy or other conditions, even conditions where it's a very gender balance in the epidemiology. But generally, these types of surveys, we see more female respondents. And we also asked about the average age that symptoms appeared for these patients. And across the different subgroups, we saw for the NT1 patients a younger age of onset at 26, but an average age of onset of 30 for NT2 and the IH patients, which, given what we understand in some of the literature, seems to be a little bit older than we would see, where more patients would normally have their symptoms occurring in puberty and onwards. So what did we capture? What data were we collecting? So the way that we measured disease and symptom severity, we're using a number of standardized measures. So we used the Epworth Sleepiness Scale. We also captured information using the Narcolepsy Severity Scale for clinical trials. And we also captured information using the Idiopathic Severity Scale. And from a quality of life perspective, we used the tool, the EuroQol 5 dimension, also known as EQ5D. Why we like to use EQ5D, it is a utility measure that is very widely used, can be used across any different disease. It's a generic measure. And it asks individuals about their quality of life on the day they are completing the survey. So how do you feel today across 5 different dimensions? Other survey topics, we also asked about the patient's characteristics, about their gender, about their income. We asked them about their comorbidities as well. And we ask about the severity of their symptoms using these standardized measures, but also asked about their coping strategies. So how are you mitigating these symptoms when they present in your daily life? We also asked about how it impacts on work, their daily activities, whether that be education, their interacting with their friends and their family. And then lastly, we asked questions about healthcare resource use and quantified that into healthcare related costs. So all of this information we carried out either with online or postal questionnaires. The majority, as you'd expect, this was a survey carried out in 2023 and 2024. The majority, 81%, responded online. And when we say we had a 65% completion rate, what that really means is that close to 2,900 of these surveys links were sent out. And that 65% of those who received the survey either met our inclusion criteria or they completed the whole survey all the way through. So all the data to date you're seeing is from individuals who completed the full data request. So we also asked about these patients, what treatment were they on? Where are they on treatment? So for the NT1 patients, about 50% reported that they were on a narcolepsy specific treatment in the last 30 days, and that they were on one treatment. We had 32% reported that they were on 2 treatments for their narcolepsy type 1, and 8% reported that they were on 3 or more treatments in the last 30 days for their condition. And we had a proportion that did not respond to that question. And then for patients who had narcolepsy type 2, similar numbers that we're seeing, about 85% reporting that they were on some type of treatment, a small proportion saying that they were on 3 or more, but 67% reporting that they were on 1 treatment for NT2. And then for the IH patients, again, just over 3/4 reporting that they were on treatment in the last 30 days, and 66% reporting they were on at least 1 treatment, 10% on 2 treatments, and we had just less than about 1% who identified as having 3 or more treatments. So overall, what we see is there is a majority in each of these categories who are on some type of narcolepsy treatment, at least 1 in the last month for their condition. Now, we asked about the impact using the Epworth Sleepiness Scale. Now, the normal range is a score of less than 10 or less. And for the NT1 patients, we saw an average score with the Epworth scale of 15. For narcolepsy type 2 and IH, a score of 14. So clearly, scores that indicate that they're having more burdensome symptoms and experiences than what would be indicative of a normal person's sleepiness experience. We also asked about cognitive challenges, and the majority, over 70%, and we have the breakdown there for the subtypes as well, reported on a daily basis experiencing cognitive challenges. And we also followed on by giving the examples of, well, what do we mean when we're talking about those cognitive challenges? Thinking about, are you experiencing difficulties thinking clearly? Are you experiencing challenges concentrating or losing words or comprehending new information, remembering or multitasking? We also asked questions about the impact of fatigue. And we saw that 3/4 of the respondents were reporting feeling fatigue on a daily basis. And I think what's important to remember from what we're seeing in terms of these cognitive challenges and the reports of those daily fatigues is that these are for patients who have also all told us that they're on some type of treatment already for their conditions. So despite that they are taking 1 or 2 or 3 different medications, they are still feeling the impact of their condition. And we also asked in the EQ5D questionnaire and in the comorbidities about anxiety and depression. And over 60% of the respondents reported that that mental burden, the anxiety and the depression from all of the things that we've heard about how patients are, the unpredictability of when symptoms present can lead to anxiety and depression. The impact that it has on their work, again, leading to that emotional burden for their condition too. And one of the mitigation strategies that we saw, that over half reported that they were carrying out daily naps in order to get through the day, in order just to function. And when we asked them about how many naps do you have on average, the NT1 patients said on average about 2. And for NT1 patients, on average, it was about 33 minutes. And the total nap time per day being just over an hour for the NT1 patients. For narcolepsy type 2 and for the IH patients, about 1.5. And that nobody gets to have half a nap, but that's really just due to the rounding and how we get to having that kind of average score. In terms of the duration per nap times, narcolepsy type 2 patients is similar, around about that 30-minute mark. And you'll notice in the IH patients, a much higher duration of that average nap time. What's really driving that number is we did have a couple of outliers who were reporting a much higher kind of average nap time. So I think in other types of these surveys, we've seen a closer to that mean, closer to that average, about a 30-minute nap. So overall, we're seeing a considerable burden, a considerable proportion of their day-to-day time being spent with daily naps. And then how does that translate into how it impacts in their work? And about 70% of those who responded to this are currently in paid work. And as I mentioned earlier, these are relatively young cohort. These patients are, these are all adults, so all 18 and older. But these are all of a cohort where one might expect that they would be in employment in a work role. And unsurprisingly, given what we've talked about in terms of the excessive daytime sleepiness, the need to take naps, the fatigue, the cognitive impact, over 80% reported that it was impacting their work. And when we asked that question, the follow-up to that was, well, tell us how that impacts your work, and ask them about, does it impact it in terms of cataplexy, alertness, general fatigue, as well. So then we get into our EQ5D responses. Now, the EQ5D tool is used to capture patients' overall quality of life in any condition. And it asks about using 5 different categories. So self-care, mobility, pain and discomfort, anxiety and depression, and usual activities. And what this questionnaire is asking is, in terms of your self-care, in terms of your ability to take a shower, to get yourself dressed, to have a meal, how much does your condition impact you for today? And what we see for the respondents in this survey, we see over half reporting none to slight impact in that self-care. But I think what's interestingly, when we look at the EQ5D data, and although we see kind of the majority for the pain, anxiety, and usual activities kind of in that lower end of the responses being none or slight, we are seeing kind of close to a third to 25% reporting a moderate to extremely severe impact across pain, discomfort, the emotional impact, and the anxiety, depression questions, and again in that usual activities section as well. And the other important element I think to ask about, to remember about the EQ5D is this is asking individuals about their experience today, the day that you're filling in that questionnaire. We do use other questionnaires to kind of, let's think about how your narcolepsy or IH has impacted over the past week or the past 4 weeks. But this is specifically on the day you're completing the survey. And I always think it's almost a little bit biased to those patients who didn't click through and didn't actually manage to complete the survey because of their symptoms and their conditions, that maybe actually we're missing out some of those patients who have it a little bit worse because we're asking them to complete a survey about 40 minutes of their day to tell us how their narcolepsy impacts. So what are our key takeaways? The majority of these individuals who responded to this survey, over 80% were currently on a narcolepsy treatment. And despite that, they were still struggling with the symptoms of their condition. Continuing symptoms, a continuing financial cost to them in terms of their impact to their work productivity, and also a clear impact to their daily life. And I want to kind of elaborate a little bit further on what we mean when we talk about the cost that we were capturing in this. So what we found is when we categorize these patients from least severe symptom scales using the Epworth symptom scale to most severe, and said that the cost for patient care, and by cost we were capturing how many times you've been to see your general practitioner, how many times you've been admitted to hospital, in terms of what current treatments that you're on. If we held as like the baseline for the least severe patients, that when we looked across the patient categories and we looked across those symptom profiles, for the most severe patients, their annual costs increased by 130% compared to the least severe patients in this group. And again, when we look to this in terms of their EQ5D scores, so in terms of EQ5D, it's on a scale of 0 being worse than death and 1 being perfect health. And you can see for those patients in the least severe category, when we looked at their EQ5D scores, we were seeing a score of 0.936. So that's a really strong score. That's a score for individuals who are having a good day. But we see those EQ5D scores decline consistently as this disease severity and the symptom severity increases. So what we're seeing in terms of the costs and the quality of life, that increased disease severity is associated with increased costs and a decline in EQ5D scores. So our conclusion. To date, this is one of the largest burden of illness surveys that has been conducted in people with hypersomnia conditions. We were able to understand that even participants who are being treated were still experiencing severe symptoms, even when they're on 2 or more medications in the last month. When we asked the individuals about how they were mitigating and how they were coping with their condition, many reported their daytime sleepiness, having naps, experiencing discomfort, but also that emotional burden in terms of anxiety and depression. And despite these respondents being of working age, we saw that most reported their conditions were really impacting their work, their ability to function effectively and efficiently at work, and that these residual symptoms were having a high impact in their quality of life. And all of the reasons that we do these types of studies is really to understand what are the symptoms that are most burdensome, and what are the symptoms that we should be looking to treat, and the impact of new medications for these patients. And I think the results really highlight the need for effective treatments that actually treat beyond just the symptoms. So I will pause now, because I know it is very difficult to interrupt Scottish people because we talk very quickly. But I wanted to open up the floor to questions if anybody wanted to ask any particular questions related to the patient survey.
Hi, I guess my question would be, when you go to the doctor, you fill out a form. How many drinks do you take a day? How much do you walk a day? But there's nothing that says, how much do you sleep a day? How much do you nap? Do you nap? Do you, how long are your naps?
Yeah.
I just think we could learn so much from that. And maybe I would have been diagnosed 40 years ago.
Yeah.
I'm upset, especially the words and the way I described it to the doctors. The ADD medicine isn't working. I still can't think. I'm depressed because I want to be able to do what everyone else can do. I can't stay awake at work. And I guess the brain fog was so bad. And I have 2 special needs adult children we fostered and adopted, that I was so focused on being a good mom that I forgot about myself. So it's, I just don't understand why it's not on a general survey when you go to a general doctor even. But I had gone to so many, so that's, I guess.
Firstly, thank you for sharing. I think what you're saying resonates with so many people in this room, that the challenges of getting that right diagnosis. And what we're trying to do in, capturing what's in the literature and capturing data from patients today is really trying to communicate beyond just the numbers on a slide deck. What does that really mean for patients? When I'm saying that patients are needing to have 2 naps a day and that those naps are 30 minutes, then what does that translate to in the terms of a working parent or somebody who's 22 doing their degree at college? And I think that that's so important that we communicate beyond the data and really help patients understand that you're not living this experience alone, and this is not you failing, but this is you trying to thrive through a really challenging condition. So thank you for sharing your experience.
So now that you've gathered all this great information, what are you doing with it?
I promise I did not plant that question. Thank you. Well, where we have taken this, actually, we presented the findings firstly last year at a European Clinical Congress. We then presented it to a Health Economics Congress last November. And next steps, my colleagues who aren't here this week are furiously back in the office writing this up into a manuscript in collaboration with Professor Dauvigné, and I'm forgetting some of the other clinicians that were part of this. And our next step is intend to publish it as a manuscript and have that out there, peer reviewed, publicly available, so that anybody in this room can download the paper and can have this as part of the tools to discuss what they're experiencing. So manuscript coming, they're working very hard on it. And I am working currently on the study in the US and Canada, and hoping to present those results next year as well.
When that manuscript's available, would it be able to be linked to the Hypersomnia Foundation?
And we will absolutely,
Website?
we can, I think we get into questions about specific copyright of the journal, but we do always intend to publish our studies from this particular one in journals that are freely available. So you don't need to have a subscription to the journal, but we will absolutely be intending to share with Hypersomnia where it's been published so that we can get access to it, absolutely. No problem. Thank you for your attention. It's been my pleasure. Have a great rest of the conference.